So today we're going to be doing a carpal tunnel release, and that involves adjusting the lunate, which is right here, that little bone right there. So I take my fingers like this, and we're going to adjust like that. Now let's demonstrate it on the patient. So now we're going to do it on the patient. So I take my hands, my thumbs right here. We're going to have the patient relax, and a nice little thrust. Awesome. Now we're going to take our handheld laser. This helps with inflammation and pain. We're going to run it over all the carpals. And she also has a little bit of thumb pain, so we're going to hit that thumb as well. So this is really good for a patient suffering with numbness, tingling in the hands and wrist. And this is our carpal tunnel protocol.